We have breaking news this hour. Health Canada is reporting a case of blood clotting in a recipient of the AstraZeneca vaccine. That is a first in this country. Hannah Thibodeau joins us now. So Hannah, what do we know about this case?
Yeah, so this is the first of one of these rare blood clots in someone who received the AstraZeneca vaccine in Canada. So this vaccine came from the Serum Institute of India, which is known as Covishield. And here's an update on how the person is doing. Now, what we know from health authorities is that they received health care and is now recovering at home, and their life is not in danger. So very good news there. The ministry also goes on to say that this case was caught thanks to the protocols put in place, and it reiterates it is just an extremely rare case. And let's put this into perspective. So this is one case in Canada so far of these rare blood clots. And let's remember, so far, 2 million doses of the AstraZeneca vaccine have been delivered to Canada. Now, I can't tell you at this time how many have been put into arms of Canadians, but they do have quite a short shelf life, and they have to be put into the arms of Canadians quite quickly. So 2 million doses have been delivered to Canada. This is one case of these rare blood clots in Canada. This is the first one, and it's in Quebec. Now, I'll take you back just a little bit on the history of this. We did learn back in March of 2021, so March of this year, in Europe, that they were having these cases of rare blood clots. And Health Canada had been working with Europe to also make sure that they had all information. Then later in March, what Canadian authorities and regulators decided to do is to follow along and also limit the use of the AstraZeneca vaccine. Right now, it's for people age 55, and this is due to concerns over those blood clots. But again, I have to keep reiterating that this is rare. And the European Medicines Agency says most of the clots have occurred in women under 60 within 2 weeks of the vaccination. But based on the current available evidence, they aren't able to identify specific risk factors. So again, the first case in Canada, 2 million doses of this have been delivered to Canada so far. So there is this concern about vaccine hesitancy. We've heard it from doctors, we've heard it from health authorities, that you can't go and say, well, I've heard this and I'm concerned about this vaccine. You can't choose what vaccine you get. You have to take the vaccine that is offered to you.
And we don't know the medical history or the medical background of this person.
No.
We don't know that. And that, excuse me, that blood clotting does happen in the world, and that it's very, very, very rare. In the U.S., a few cases of blood clotting has that country putting the brakes on the Johnson & Johnson vaccine. The Johnson & Johnson vaccine has been administered to, I believe it's 6 million doses in the United States. It has been approved by Health Canada, but no vaccine has been shipped to Canada, the J&J, yet. What are officials saying about it?
Okay, so let's pick up on what happened in the United States there. So you're right, 6.8 million doses have gone into the arms of Americans of the Johnson & Johnson vaccine. This is a vaccine that only needs one dose. In the United States, there were 6 occurrences of these rare blood clots, and it was all in women between the ages of 18 and 46. Unfortunately, one of those women did die from this. Now, here in Canada, as you mentioned, and rightfully so, we have a contract with Johnson & Johnson for 10 million doses of their vaccine to be delivered in the second and third quarter of this year. Now, we are now in that second quarter. We're supposed to get some doses before the end of April. We don't know what the delivery schedule is as of yet, but we did hear the Prime Minister on this a little bit earlier. Here's what he had to say.
Obviously, we're following closely developments in the United States, and we can assure everyone that Health Canada will, every step of the way, put the health of Canadians first and foremost in any decisions we make around distributing vaccines.
One other thing he did remind Canadians is there could be concern out there. Okay, well, if we can't use this down the road, will this affect our vaccine schedule? What the Prime Minister did have to say to that is because of the fact that we have orders with Pfizer, with Moderna, as well as AstraZeneca, we are still on target without the Johnson & Johnson vaccine to still get 44 million doses of the other 3 vaccines by the end of June.
All right. Hannah, thank you. The CBC's Hannah Thibodeau live in Ottawa. For more on this, I want to bring in Dr. Noah Ivers. He's a family physician and researcher at Women's College Hospital in Toronto. Dr. Ivers, thank you very much for taking the time to be with us today. Dr. Ivers, I want to ask you first about this first case of blood clotting in a Canadian. The person is recovering after receiving the AstraZeneca vaccine. What do you make of that?
Thanks, Andrew. The first thing to say is, our best wishes to this person and to their family as they recover. The next thing to say is that, it's remarkable how far we've come. A number of weeks ago, we didn't know this syndrome existed. This is let's call it a 1 in a million syndrome. And now we know how to look out for it. We know how to treat it. And, from what I hear, God willing, this woman is going to be fine. So those are my initial thoughts, is that, this is one of those things that is very rare, but if you do enough vaccinations with this vaccine, you're going to see one. And now we've gotten there. To get there, we had to inject something like 500,000 AstraZeneca vaccines, or in this case, the Covishield version of it. So it's very, very rare, and this woman is doing okay, and hopefully it continues that way. But most of all, our healthcare professionals are ready and waiting and watching for this very rare event and able to treat it.
We were trying to actually figure that out exactly in terms of, is that your understanding, Dr. Ivers? It's about 500,000 doses of AstraZeneca that have been put into arms so far?
I checked the data online earlier today, and that's the numbers I saw on the Health Canada website. For sure, it's not up to date to the minute.
No, but that's around that.
We're looking at 500 to 700,000, somewhere in there. Okay.
So what do you think people need to do? We try in the media, we try and be very responsible. And of course, we report all of this. What's your message to people when they hear something like this? It can sometimes amplify in their heads, right?
Oh, yeah. I've mentioned to media before that my parents have been immunized with AstraZeneca, and I have no regrets. So I'd like to start there.
Yep.
But for sure, they're going to message me when they hear about this news, and they're going to call me up and ask me questions about it. And what I'm going to tell them is that we have really, really good evidence that the AstraZeneca vaccine is saving lives right now. It seems, by the latest data, to have saved at least 10,000 lives in the UK already. It will, for people that are at risk of COVID, reduce their risk of, getting severely ill from COVID. And that benefit for the vast majority of people who are at risk far outweighs this tiny, tiny risk that we are seeing, and that is real. We make decisions in our daily lives all the time when we're weighing one thing against another. Mm-hmm. And when those decisions get really, really complex and nuanced, I tell people to go talk to their own healthcare professional about it. Mm-hmm. As a family doc, this is the kind of conversation I have with my patients about all sorts of treatments every day.
And Dr. Ivers, the reason why this kind of becomes top of mind is because we're in a pandemic, we're in a third wave. This country is being hit very hard. Vaccines are rolling out and getting into arms. But something like blood clotting, it does happen outside of a pandemic in normal times that probably wouldn't be getting this kind of attention, right? Because that's just the nature of where we are.
Yeah. I think it's true that, again, it's hard to figure out what is a signal and what's noise. Mm-hmm. We know that when people get a vaccine, if you give it to 10, 100 million people, some of those people in the next few days are going to get in a car accident, or, get hit by lightning, or, whatever. And figuring out which of those things are completely spontaneous and which things might be related to the vaccine itself is really, really difficult. Mm-hmm. I'd like to is how amazing it is that our surveillance systems can pick up these sort of 1 in a million events, make sense of them, and then make policy decisions about them to keep people as safe as possible and to make sure the risk is as minimized as it can be.